The plain CT scan abdomen of a 3-year-old male baby who presented with a gradually growing painless mass in left half of abdomen. Now this is the mass here. Amorphous and nodular calcifications are present in the mass. It fills most of the left half of abdomen. This is the CT chest. No pulmonary metastases are present. This is the contrast NAN CT scan of abdomen. There is mild hepatosplenomegaly. Vertical span of liver is approximately 11.5 centimeters, while spleen measures approximately 9.0 centimeters. Now this is the mass here in left half of abdomen. It shows non-homogeneous enhancement. Focal areas of necrosis are present. Amorphous and nodular calcifications are seen. Now this most probably is the left adrenal gland here. On right side, this is the right adrenal gland. So adrenal glands are clear. This mass extends across the midline onto right side. It has surrounded proximal part of the celiac trunk in this region. Superior mesenteric artery is surrounded by the mass. This is inferior vena cava. Now this is portal vein here. This is the superior mesenteric vein, which is displaced towards right side by the mass. This is the splenic vein. So superior mesenteric artery is surrounded by the mass. Both renal arteries are also surrounded by the mass. This is aorta, which is surrounded by the mass and it is displaced anteriorly. The mass extends across the midline onto right side. This is inferior vena cava. It is displaced towards right side. Its lumen is squeezed, markedly narrowed. Lower part of the inferior vena cava slightly dilated. Now since the mass has surrounded and occluded the lumen of left renal vein, so left renal vein extends downwards, communicates with the mesenteric veins and drains into the mesenteric veins. So it is a case of neuroblastoma, which is originating from the sympathetic chain along the aorta. Typical features of neuroblastoma are present, showing calcifications extending across the midline onto right side, surrounding blood vessels. Now please observe that posteriorly it lies in contact with the left psoas muscle here. It extends downwards in left paraaortic region. Now this is the lower part of abdominal aorta. This is right common iliac artery. This is left common iliac artery, and extends downwards almost up to the anterior surface of the left common iliac artery. The rest of the abdomen is essentially normal. Multiple sub-centimeter sized lymph nodes are present in the root of mesentery, like this one here. These may be inflammatory in origin or metastatic. This is the coronal scan. Same findings: left renal artery, right renal artery, aorta surrounded by the mass. This is inferior vena cava, which is displaced towards right side. Its lumen is markedly narrow. This is the sagittal scan. Please observe the vascular luminal narrowings and involvements of the blood vessels. The mass has compressed entire surface of left kidney. However, its interfaces are distinct and there is no involvement of left kidney. The mass has compressed renal pelvis, resulting in mild fullness of left collecting system.